anterior around the ASIS. And again, I don't want my fingertips on it. Get in there so that you have a nice contact surface. And I'm going to keep a nice straight arm. I'm not pulling up with my hand. I'm pulling up with my body. But I'm going to just gently pull posterior and a little bit medial. Remember when we did the thigh thrust test? Where did we push? Posterior, yeah, and lateral. And now this is, we're kind of pulling posterior and medial here. All right, so we're going to feel that.
Is the other hand stabilizing there?
Now the weight of the body stabilizes. I'm having to stabilize a little bit now just because otherwise I'd just pull the whole thing up.
Is it palpating? Are you palpating with that right hand?
Yeah, this finger is palpating. That's what I'm doing right here. I'm feeling, as I pull this up, do I feel any movement between the two? The sacral rocking. So we talked about that S2 being the pivot point and moving around it. So all we're going to do is come above and below S2. And so you're going to push anterior below, and you should feel the superior portion of the sacrum rise. And you're going to push anterior above, and you should feel the inferior portion rise. You're wanting to feel it rock back and forth. And all you're trying to make a judgment of is, is it rocking really freely, or what you should feel is just a little bit of rocking back and forth. The quadrants. So we talked about the ILAs. So those would be basically, if you think about the ILAs as the inferior quadrants, so the right would be the right inferior quadrant, the right ILA. The left would be the left inferior quadrant. And then up around S1, so right in that sacral sulcus, would be the superior quadrant, so right superior quadrant, left superior quadrant. And what I'm doing is I'm just pushing down in that area, usually with a thumb and maybe a dummy thumb technique, and I'm feeling how does it move in each of those quadrants. We didn't talk about the different axes of rotation in the sacrum because from a treatment standpoint, in a diagnosis standpoint, it doesn't really matter. But what you do want to know is, if I'm pushing around in these different places, is there one that's like, wow, this really moves, and the rest don't? That kind of tells you about, if I'm pushing anterior on this right superior quadrant, and that's really mobile, then that makes me think about there might be some instability there. But if I push posterior, if I push on the inferior quadrant on the other side, and it doesn't move much in that direction, then okay, it starts to just tell me like a little bit about how that joint's moving, because it should kind of rock in all four directions. If you think like a cross back there should be pretty equal rocking in all four directions.
What was the superior quadrant location then?
S1, and right in that sacral sulcus, just pushing down. And then the side-lying medial ileal test. But just like you did the sideline compression test before, with this, you can use your hand. I like to use my forearm a lot of times with it to come on. And I'm palpating that same sacral sulcus and just doing a little bit of that anterior compression. And all I want to feel is, am I getting some movement? Is the PSIS rocking a little bit? So remember, if we think about talked earlier about the ilium kind of compressing in to provide stability. And so what you'll find with this test is if someone is hypermobile, then when you do this test, there might be a lot more movement there. They kind of rock a little bit more than someone who's more normal. So you should feel some movement. There shouldn't be a lot of movement. If there's a little bit, then that's good. All right, so can I get a person to just do the mom to